Welcome everybody to this lecture. We talk about the indication to do veneers. We need to know exactly when we can use this kind of technique. Frankly speaking, I could say that many friends said to me, I have no cases in which I could really utilize the veneers technique. But I don't believe it is true. We have a lot of cases that can be able to be treated in this way. So let me talk about the indication at this point. Showing some cases like wear on the incisor ledge, like on the bottom on the right side, or cuspid in the lateral incisor position, for example. Both cases are something that can be used. So, other case, diastemas, and again, cuspids on the lateral incisor position. Or this case, like having big restorations and a lot of composites that are more or less kind of, combination between composites, between natural dentition, and I believe that is another case that can be used. Colors can be changed, or even wear, incisor wear. But we can cut partially to have not undercuts on the major part. But distally will be very complicated if you don't do any kind of enamel adjustment. So we can have enameloplastic procedure there to really reduce the enamel there. And not to be on dentin, of course, at the end, but more or less to have the chance to reduce it. So we have do a bevel preparation on the cervical area, on the distal part of the central incisor, between the central incisor and lateral incisor. We open the space over there, as you could see there, exactly this arrow. And we also, thanks to the preparation that we have done on the right central incisor, we had a part of the preparation that is partially in dentin, but all the rest is in enamel, especially the interproximal confine and finiture line that is completely in enamel, as you see here. That is a case that was made only 2-3 years ago, so a very recent case. And the patient again need the orthodontic treatment. No story. That's the best solution for sure. We tried to force this young lady to do it, but she didn't want it. She didn't want to have any appliance, fixed appliance in place, and we decided to do some additional veneer in this case. Look at this. Seems a rabbit. Only the two central incisors visible. You see that we have increased the bulk of the two lateral incisors. And of course, looking at these two veneers on the lateral incisor seem to be crazy because they are not lateral incisor anymore. They still seem to be like, I don't know, a flat area, big area, very large. But remember, the patient doesn't feel nothing strange because on the lingual part, on the palatal part of the two lateral incisor, she was the habit also before to feel the presence of the lateral incisor. So I cut everything. I take the color. We did some bleaching, home bleaching that was really very